Posterior abdominal wall. Introduction. Posterior abdominal wall includes the study of the following structures. 1. Abdominal aorta. 2. Inferior vena cava. 1. Abdominal parts of the azygos and hemiazygos veins. 2. Lymph nodes of posterior abdominal wall and cisterna chyli. 3. Muscles of the posterior abdominal wall and thoracolumbar fascia. 4. Nerves of the posterior abdominal wall including lumbar plexus and the abdominal part of autonomic nervous system. Dissection. Expose the centrally placed abdominal aorta and inferior vena cava to the right of aorta. Trace the ventral, lateral, posterior, and terminal branches of abdominal aorta and the respective tributaries of inferior vena cava. Remove the big lymph nodes present in the posterior abdominal wall. Identify the muscles of the posterior abdominal wall by removing their facial coverings. These are psoas major, quadratus lumborum, and iliacus. Avoid injury to the vessels and nerves related to the muscles. Detach psoas major from the intervertebral discs and vertebral bodies and trace the lumbar vessels and the rami comune icons posteriorly deep to the tendinous arches from which psoas major arises. Dissect the genitofemoral nerve seen on the anterior surface of psoas major. Trace the various branches of lumbar plexus, e.g. iliohypogastric, ilioinguinal, lateral cutaneous nerve of thigh and femoral nerve. These exit from the lateral border of psoas major. Identify obturator and lumbosacral trunk seen on the medial aspect of the muscle. Locate the lumbar part of the right and left sympathetic chains. Trace their branches into the coeliac and superior mesenteric plexuses of nerves in addition to giving rami comune icons to the lumbar spinal nerves. Abdominal aorta, beginning course and termination. The abdominal aorta begins in the midline at the aortic opening of the diaphragm, opposite the lower border of vertebra TL2. It runs downwards and slightly to the left in front of the lumbar vertebrae, and ends in front of the lower part of the body of vertebra L4, about 1.25 centimeters to the left of the median plane, by dividing into the right and left common iliac arteries. Due to the forward convexity of the lumbar vertebral column, aortic pulsations can be felt in the region of the umbilicus, particularly in slim persons. Relations anteriorly, from above downwards, the aorta is related to 1. Coeliac and aortic plexuses. 1. Body of the pancreas, with the splenic vein embedded in its posterior surface. 2. Third part of the duodenum. Posteriorly, the aorta is related to 1. The bodies of upper 4 lumbar vertebrae and the corresponding intervertebral discs. 2. Anterior longitudinal ligament. To the right side of the aorta there are 1. Inferior vena cava. 2. Right crus of diaphragm. 3. Cistern chyli and the azygos vein in the upper part. To the left side of the aorta there are from above downwards, a left crus of diaphragm. B. Pancreas. C. Fourth part of duodenum. Branches. The branches of the abdominal aorta are classified as given below. Ventral branches, which develop from ventral splanchnic or vitelline orpharies and supply the gut. These are as follows. A. Coeliac trunk gives left common hepatic and splenic branches. A. Superior mesenteric artery, see Chapter 21, gives inferior pancreaticoduodenal, middle colic, right colic, iliacolic and 12-15 jejunal and ileal branches. B. Inferior mesenteric artery, see Chapter 21, gives left colic, sigmoid arteries and continues as superior rectal. Lateral branches, which develop from the lateral splanchnic or mesonephric arteries and supply the viscera derived from the intermediate mesoderm. These are right and left, A. Inferior phrenic arteries. Middle suprarenal arteries, A. Renal arteries. B. Testicular or ovarian arteries. Asterisk. Somatic branches represent the somatic intersegmental arteries and are distributed to the body wall. These are 1. Lumbar arteries, 4 pairs. 1. Median sacral artery. 2. Terminal branches are pair of common iliac arteries. 3. They supply the pelvis and lower limbs. Inferior phrenic arteries. Inferior phrenic arteries arise from the aorta just above the coeliac trunk. Each artery runs upwards and laterally on the corresponding crus of the diaphragm, medial to the suprarenal gland. Each artery gives off 2 to 3 superior suprarenal arteries, and is then distributed to the diaphragm. Middle, i.e. suprarenal arteries. Middle suprarenal arteries arise at the level of the superior mesenteric artery. Each passes laterally and slightly upwards over the corresponding crus of the diaphragm, to reach the gland. Renal arteries. Renal arteries are large arteries which arise from the abdominal aorta just below the level of origin of the superior mesenteric artery. The right renal artery passes laterally behind the inferior vena cava to reach the hilum of the right kidney. The left renal artery runs behind the left renal vein, and the splenic vein. Each artery gives off the inferior suprarenal and ureteral branches, and is then distributed to the kidney. Gonadal, testicular or ovarian arteries. Gonadal arteries are small and arise from the front of the aorta a little below the origin of the renal arteries. Each artery runs downwards and slightly laterally on the psoas major. On the right side the artery crosses in front of the inferior vena cava, the ureter, and the genitofemoral nerve. It passes deep to the ilium. On the left side the artery crosses in front of the ureter and the genitofemoral nerve, and passes deep to the colon. The testicular artery joins the spermatic cord at the deep inguinal ring, and traverses the inguinal canal. Within the cord, it lies anterior to the ductus deferens. At the upper pole of the testis, it breaks up into branches which supply the testis and the epididymis. The ovaries artery crosses the external iliac vessels at the pelvic brim to enter the suspensory or infundibulopelvic ligament of the ovary. It thus enters the broad ligament and runs below the uterine tube to reach the ovary through the mesovarium. The artery gives a branch which continues medially to anastomose with the uterine artery, and supplies twigs to the uterine tube and to the pelvic part of the ureter. Lumbar arteries. 4 pairs of lumbar arteries arise from the aorta opposite the bodies of the upper 4 lumbar vertebrae. The small, 5th pair is usually represented by the lumbar branches of the iliolumbar arteries. The upper 4 lumbar arteries run across the sides of the bodies of the upper 4 lumbar vertebrae, passing deep to the crura, upper arteries only, deep to the psoas major and the quadratus lumborum to end in small branches between the transversus and internal oblique muscles. Each artery gives off a dorsal branch, which arises at the root of the transverse process. The dorsal branch gives off a spinal branch to the vertebral canal, and then runs backwards to supply the muscles and skin of the back. Median sacral artery. Median sacral artery represents the continuation of the primitive dorsal aorta. It arises from the back of the aorta just above the bifurcation of the latter, and runs downwards to end in front of the coccyx. It supplies the rectum and anastomoses with the iliolumbar and lateral sacral arteries. Common iliac arteries. Course. These are the terminal branches of the abdominal aorta, beginning in front of vertebra L4, 1.25 cm to the left of the median plane. On each side it passes downwards and laterally and ends in front of the sacroiliac joint, at the level of the lumbosacral intervertebral disc, by dividing into the external and internal iliac arteries. The right common iliac artery passes in front of the commencement of the inferior vena cava. The right common iliac vein is posterior to the vena cava above, and medial to it below. The left common iliac artery is shorter than the right artery. It is crossed at its middle by the inferior mesenteric vessels. The left common iliac vein is medial to it. The structures lying on the left ala of the sacrum, i.e. sympathetic trunk, lumbosacral trunk, into lumbar artery and obturator nerve are deep to it. Inferior vena cava. The inferior vena cava is formed by the union of the right and left common iliac veins on the right side of the body of vertebra L5. It ascends in front of the vertebral column, on the right side of the aorta, grooves the posterior surface of the liver, pierces the central tendon of the diaphragm at the level of vertebra T8, and opens into the lower and posterior part of the right atrium. Relations anteriorly, from above downwards inferior vena cava is related to, 1. Posterior surface of the liver. 2. Epiploic foramen. 3. First part of the duodenum and the portal vein, 4. Head of Pecreus along with the bile duct. 5. 3. Road part of duodenum. Posteriorly, above, The right crus of the diaphragm is separated from the inferior vena cava by the right renal artery, the right coeliac ganglion, and the medial part of the right suprarenal gland. Below, it is related to the right sympathetic chain and to the medial border of the right psoas. Tributaries 1. The common iliac veins formed by the union of the external and internal iliac veins unite to form the inferior vena cava. Each vein receives an iliolumbar vein. The median sacral vein joins the left common iliac vein. 2. The third and fourth and fifth lumbar veins run along with the corresponding arteries and open into the posterior aspect of the inferior vena cava. The veins of the left side cross behind the aorta to reach the vena cava. The first and second lumbar veins end in the ascending lumbar vein, on the right and the left sides. The ascending lumbar vein is an anastomotic channel which connects the lateral sacral, iliolumbar, and the subcostal veins. It lies within the psoas muscle, in front of the roots of the transverse processes of the lumbar vertebrae. On joining the subcostal vein it forms the azygos vein on the right side, and the Hemiazygos vein on the left side. 3. The right testicular or ovarian vein opens into the inferior vena cava just below the entrance of the renal veins. The left gonadal vein drains into the left renal vein. The renal veins join the inferior vena cava just below the transpyloric plane. Each renal vein lies in front of the corresponding artery. The right vein is shorter than the left and lies behind the second part of the duodenum. The left vein crosses in front of the aorta, and lies behind the pancreas and the splenic vein. It receives the left suprarenal and gonadal veins. 5. The right suprarenal vein is extremely short. It emerges from the hilum of the glands, and soon opens into the inferior vena cava. The left suprarenal vein opens into the left renal vein. The hepatic veins are 3 large and many small veins which open directly into the anterior surface of the inferior vena cava just before it pierces the diaphragm. These act as important support of liver. Thrombosis in the inferior vena cava causes edema of the legs and back. The collateral venous circulation between the superior and inferior vena cavae is established through the superficial or deep veins, or both. The participating main superficial veins include the I. Superficial epigastric. 2. Lateral thoracic. 3. Thoracoepigastric. Other veins are internal thoracic, posterior intercostal, external pudendal and lumbovertebral veins. The deep veins are the azygos, hemiazygos, and lumbar veins. The vertebral venous plexus may also provide an effective collateral circulation between the two venae cavae. Abdominal aneurysms, dilatation of the vessel, most common site is between the renal arteries and bifurcation of the abdominal aorta. Abdominal parts of azygos and hemiazygos veins. These veins usually begin in the abdomen. The azygos vein arise from the posterior surface of the inferior vena cava near the renal veins, may be formed by the union of the right ascending lumbar vein and the right subcostal vein. It enters the thorax by passing through the aortic opening of the diaphragm. The Hemiazygos vein is the mirror image of the lower part of the azygos vein. It arises from the posterior surface of the left renal vein, or may be formed by the union of the left ascending lumbar vein and the left subcostal vein. It enters the thorax by piercing the left crus of the diaphragm. Lymph nodes of posterior abdominal wall. These are the external iliac, common iliac, and lumbar or aortic nodes. The external iliac nodes 8 to 10 lie along the external iliac vessels, being lateral, medial and anterior to them. They receive afferents from 1. Inguinal lymph nodes 1. Deeper layers of the infra-umbilical part of the anterior abdominal wall 2. Adductor region of the thigh. 3. Glans penis or clitoris. 4. Membranous urethra. 5. Prostate. 6. Fundus of urinary bladder. 7. Cervic uteri. 8. Part of vagina. Their efferents pass to common iliac nodes. The inferior epigastric and circumflex iliac nodes are outlying members. 1. The external iliac group. The common iliac nodes, 4 to 6 in number, lie along the common iliac artery below the bifurcation of the aorta in front of vertebra L5 or in front of the sacral promontory. They receive afferents from the external and internal iliac nodes, and send their efferents to the lateral aortic nodes. The lumbar or aortic nodes are divided into preaortic and lateral aortic groups. The preaortic nodes be directly anterior to the abdominal aorta, and are divisible into coeliac, superior mesenteric and inferior mesenteric groups. They receive afferents from intermediate nodes associated with the subdiaphragmatic part of the gastrointestinal tract, the liver, the pancreas, and the spleen. Their efferents form the intestinal fronts which enter the cisterna chyli. The lateral aortic codes lie on each side of the abdominal aorta. They receive afferents from the structures supplied by the lateral and dorsal branches of the aorta and form the common iliac nodes. Their efferents from a lumbar trunk on each side, both of which terminate in the cisterna chyli. Cisterna chyli. This is an elongated lymphatic sac, about 5 to 7 centimeters long. It is situated in front of the first and second lumbar vertebrae, immediately to the right of the abdominal aorta. It is overlapped by the right crus of the diaphragm. Its upper end is continuous with the thoracic duct. It is joined by the right and left lumbar and intestinal lymph trunks. The lumbar trunks arise from the lateral aortic nodes, and bring lymph from the lower limbs, the pelvic wall and viscera, the kidneys, the suprarenal glands, the testes or ovaries, and the deeper parts of the abdominal wall. The intestinal trunks bring lymph from the stomach, the intestine, the pancreas, the spleen, and the antero-inferior part of the liver. Muscles of the posterior abdominal wall. These are the psoas major, the psoas minor, the iliacus and the quadratus lumborum. Their attachments are given in table and their nerve supply and actions are given in table. Some additional facts about the psoas major are given below. Relations of the psoas major. In the posterior mediastinum. The uppermost part of the psoas major lies in the posterior mediastinum, and is related anteriorly to the diaphragm and pleura. In the abdomen. Its anterolateral surface is related to 1. Medial lumbocostal arch or medial arcuate ligament and psoas fascia. 2. Peritoneum and extraperitoneal connective tissue. 3. Kidney and ureter. 4. Renal and gonadal vessels. 5. Genitofemoral vessels. 6. Psoas minor. 7. Inferior vena cava. 8. Terminal ileum on the right side. Colon on the left side. The posterior surface is related to 1. Transverse processes of lumbar vertebrae. 2. Lumbar plexus lies in substance of the muscle. The medial surface is related to 3. 1. Bodies of the lumbar vertebrae. 4. 2. Lumbar vessels. The medial, anterior, margin is related to 1. Sympathetic chain. 2. Aortic lymph nodes. 3. Inferior vena cava on the right side. 4. 4. Aorta on the left side. 5. External iliac vessels along the pelvic brim. In the thigh, anteriorly, femoral artery and fascia lata. Posteriorly, capsule of hip joint separated by a bursa. Medially, pectineus and femoral vein. Laterally femoral nerve and iliacus. Psoas abscess. The psoas is enclosed in the psoas sheath, a part of the lumbar fascia. Pus from tubercular infection of the thoracic and lumbar vertebrae may track down through the sheath into the thigh, producing a soft swelling in the femoral triangle. The typical posture of a laterally rotated lower limb following fracture of the neck of the femur is produced by contraction of the psoas muscle. Thoracolumbar fascia, lumbar fascia. Lumbar fascia is the fascia enclosing the deep muscles of the back. It is made up of 3 layers: posterior, middle, and anterior. The posterior layer is thickest and the anterior layer thinnest. Extent. The posterior layer covers the loin and is continued upwards on the back of the thorax and neck. The middle and anterior layers are confined to the lumbar region. Attachments. Posterior layer. Medially, the posterior layer is attached to the tips of the lumbar and sacral spines and the interspinous ligaments. Laterally, it blends with the middle layer at the lateral border of the erector spinae. Superiorly, it continues onto the back of the thorax where it is attached to the vertebral spines and the angles of the ribs. Inferiorly, it is attached to the posterior 1/4 of the outer lip of the iliac crest. Middle layer. Medially, the middle layer is attached to the tips of the lumbar transverse processes and the intertransverse ligaments. Laterally, it blends with the anterior layer at the lateral border of the quadratus lumborum. Superiorly, it is attached to the lower border of the 12th rib and to the lumbocostal ligament. Inferiorly, it is attached to the posterior part of the intermediate area or the iliac crest nerves of the posterior abdominal wall. Lumbar plexus. The lumbar plexus lies in the posterior part of the substance of the psoas major muscle. It is formed by the ventral rami of the upper four lumbar nerves. The first lumbar nerve receives a contribution from the subcostal nerve, and the fourth lumbar nerve gives a contribution to the lumbosacral trunk, which takes part in the formation of the sacral plexus. The branches of the lumbar plexus are summarized. The iliohypogastric nerve, L1. The iliohypogastric nerve, L1, emerges at the lateral border of the psoas, runs downwards and laterally in front of the quadratus lumborum, and behind the kidney and colon, pierces the transversus abdominis a little above the iliac crest, and runs in the abdominal wall supplying the anterolateral muscles. Ilioinguinal nerve, Li. The ilioinguinal nerve, L1, has the same course as the iliohypogastric nerve, but on a slightly lower level. It exits through superficial inguinal ring. Genitofemoral nerve. The genitofemoral nerve, L1, L2 ventral divisions, emerges on the anterior surface of the psoas muscle near its medial border and runs downwards in front of the muscle. Near the deep inguinal ring it divides into femoral and genital branches. The femoral branch passes through the arterial compartment of the femoral sheath and is distributed to the skin of the upper part of the front of the thigh. The genital branch pierces the psoas sheath and enters the inguinal canal through the deep inguinal ring. In the male, it supplies the cremaster muscle, and in the female, it gives sensory branches to the round ligament of the uterus and to the skin of the labium majus. The lateral cutaneous nerve of the thigh. The lateral cutaneous nerve of the thigh, L2, L3, dorsal divisions, emerges at the lateral border of the psoas, runs downwards and laterally across the right iliac fossa, over the iliacus and reaches the anterior superior iliac spine. Here it enters the thigh by passing behind the lateral end of the inguinal ligament. Femoral nerve. The femoral nerve, L2, L3, L4, dorsal divisions, emerges at the lateral border of the psoas below the iliac crest, and runs downwards and slightly laterally in the furrow between the psoas and iliacus. It lies under cover of the fascia iliaca. It passes deep to the inguinal ligament to enter the thigh lying on the lateral side of the femoral sheath. Before entering the thigh it supplies the iliacus and pectineus. In thigh it supplies quadriceps femoris and sartorius. The Obturator Nerve. The Obturator Nerve, L2, L3, L4, ventral divisions, emerges on the medial side of the psoas muscle and runs forwards and downwards on the pelvic wall, below the pelvic brim. Near its commencement it is crossed by the internal iliac vessels and the ureter. It enters the thigh by passing through the obturator canal. It supplies three adductor muscles, obturator externus and gracilis, see Fig 4.4. Lumbosacral trunk. The lumbosacral trunk, L4, L5, ventral rami, is formed by union of the descending branch of nerve L4 with nerve L5. It enters the lesser pelvis by passing over and grooving the lateral part of the ala of the sacrum, posterior to the common iliac vessels and the medial part of the psoas. It is related medially to the sympathetic chain, and laterally to the iliolumbar artery and the obturator nerve. In the pelvis, it takes part in the formation of the sacral plexus. Abdominal part of the autonomic nervous system. The abdomen is supplied by both sympathetic and parasympathetic nerves. The sympathetic iters are derived from two sources. 1. The lumbar sympathetic trunk supplies somatic branches to the lower abdominal wall and the lower limb, and visceral branches for the pelvic organs. 2. The coeliac plexus, formed by splanchnic nerves from the thorax, supplies all the abdominal organs, including the gonads. The parasympathetic nerves are also derived from two sources. A. The vagus joins the celiac plexus. A. The pelvic splanchnic nerves join the inferior hypogastric plexus. Lumbar sympathetic chain. This is ganglionated chain situated on either side of the bodies of the lumbar vertebrae containing 5 ganglia. The lumbar sympathetic chain is continuous with the thoracic part deep to the medial arcuate ligament. It runs vertically downwards along the medial margin of the psoas major, and across the lumbar vessels. On the right side, it is overlapped by the inferior vena cava and on the left by the lateral aortic lymph nodes. The lumbar chain ends by becoming continuous with the sacral part of the sympathetic chain behind the common iliac vessels. The anterior primary rami of the first and second lumbar nerves send white rami commune icons to the corresponding ganglia. Branches. Lateral. All the 5 lumbar nerves receive gray rami commune icons from the corresponding lumbar ganglia. The gray rami carry fibers which are distributed to the lower abdominal wall and to the lower limb. Medial. The lumbar splanchnic nerves are generally 4 in number. The upper 2 join the coeliac and aortic plexuses, and the lower 2 join the superior hypogastric plexus. Coeliac ganglia and coeliac plexus. The coeliac ganglion is the largest ganglion in the body, situated one on each side of the coeliac trunk. Each ganglion is irregular in shape and is usually divided into a larger upper part which receives the greater splanchnic nerve, and a smaller lower part, aorticorenal ganglion, which receives the lesser splanchnic nerve. The celiac plexus or solar plexus is closely related to the celiac ganglion. The plexus is situated on the aorta around the coeliac trunk and around the root of the superior mesenteric artery. The plexus extends onto the crura or the diaphragm. It is overlapped by the inferior vena cava and by the pancreas. The fibers making up the plexus are as follows. A. Preganglionic sympathetic fibers reach it through the greater and lesser splanchnic nerves. B. Postganglionic sympathetic fibers arising in the coeliac ganglion. C. Preganglionic vagal fibers are derived from the posterior vagal trunk containing fibers from both the right and left vagal nerves. The fibers from the right vagus predominate. D. Sensory fibers from the diaphragm reach the coeliac plexus along the inferior phrenic arteries. 3 branches for the coeliac plexus forms a number of secondary plexuses which surround branches of the aorta. 5.1 The phrenic plexus passes along the inferior phrenic artery to the suprarenal gland. The right phrenic plexus contains a right phrenic ganglion. 6. The hypophytic plexus is distributed to the liver, the gallbladder, and the bile ducts. 7. The left gastric plexus passes to the stomach. 1. The splenic plexus supplies the vessels and smooth muscle of the spleen. 5. The suprarenal plexus contains preganglionic fibers, that end in relation to the chromaffin cells of the suprarenal gland. These cells are homologous with postganglionic sympathetic neurons. 6. The renal plexus is formed by filaments from the coeliac plexus, the aorticorenal ganglion, the lowest thoracic splanchnic nerve, the first lumbar splanchnic nerve and the aortic plexus. It supplies the kidney and the upper part of the ureter. 7. The testicular fibers supplies the testis, the epididymis, and the vas deferens. 8. The superior mesenteric plexus contains a superior mesenteric ganglion, and supplies the territory of the superior mesenteric artery. 9. The abdominal aortic plexus or intermesenteric plexus is formed by the coeliac plexus and filaments from the first and second lumbar splanchnic nerves. It is situated on the sides and the front of the aorta, between the origins of the superior and inferior mesenteric arteries. Actually, it is made up of 4 to 12 intermesenteric nerves connected by oblique filaments. It is continuous above with the coeliac plexus and below with the superior hypogastric plexus. Its branches form parts of the testicular, inferior mesenteric, iliac and superior hypogastric plexuses, and supply the inferior vena cava. The inferior mesenteric plexus is formed chiefly by fibers from the aortic plexus. It is distributed to the territory of the inferior mesenteric artery. The superior hypogastric plexus. The superior hypogastric plexus lies in front of the bifurcation of the abdominal aorta, the left common iliac vein, the median sacral vessels, the body of fifth lumbar vertebra, the promontory of the sacrum, and between the 2 common iliac arteries. Though it is often called the presacral nerve, it is neither a single nerve nor presacral in position. The plexus lies more towards the left, and contains scattered nerve cells. The plexus is formed by fibers from the following sources. Sympathetic nerve, 1 descending fibers from the aortic plexus. 2-3 RD and 4th lumbar splanchnic nerves. Parasympathetic nerves. Fibers from the pelvic splanchnic nerves reach it through the inferior hypogastric plexus. Usually these fibers ascend through the left part of the superior hypogastric plexus, cross the sigmoid and left colic vessels, and are distributed along the vessels as well as independently to the derivatives of the hindgut. Branches. 1 inferiorly, the plexus divides into the right and left hypogastric nerves which descend into the pelvis and form the 2 inferior hypogastric plexuses. 2 superiorly, the hypogastric plexus also gives off branches to the ureteric, testicular, or ovarian, and the common iliac plexuses. Inferior hypogastric plexuses. There are 2 plexuses, right and left. Each inferior hypogastric or pelvic plexus lies in the extraperitoneal connective tissue of the pelvis. In the male, it lies on the side of the rectum, the seminal vesicle, the prostate, and the posterior part of the urinary bladder. In the female, it lies on the side of the rectum, the cervix, the vaginal fornix and the posterior part of the urinary bladder, and also extends into the base of the broad ligament of the uterus. The plexus contains numerous small ganglia. The fibers forming the inferior hypogastric plexuses are as follows: sympathetic nerves, T10 to L2. 1. These are chiefly derived from the hypogastric nerve, which is represented either by a single nerve or by a plexus. 2. A few sympathetic fibers come from sympathetic ganglia. Parasympathetic nerves FS2, S3, S4. These are derived from the pelvic splanchnic nerves. They relay in the walls of the viscera supplied. Branches from the inferior hypogastric plexus are distributed to the pelvic viscera and some abdominal viscera, either directly or along the branches of the internal iliac artery. Parasympathetic system. As already noted, the parasympathetic supply of the abdomen proper comes from the vagi, and of the pelvis and hindgut from the pelvic splanchnic nerves or nervi erigents, S2, S3, S4. These fibers are distributed through the coeliac and inferior hypogastric plexuses respectively. Functional considerations. In general, the sympathetic nerves are vasomotor, motor to sphincters, inhibitory to peristalsis, and sensory to all the viscera supplied. The parasympathetic nerves, on the other hand, are motor and secretomotor to the gut and the glands associated with it. Layers of the abdomen. The following 6 layers in the abdomen are: visceral pain. Viscera are insensitive to cutting, crushing, or burning. However, visceral pain is caused by a. Excessive distension, b. Spasmodic contraction of smooth muscle, c. Ischemia. The pain felt in the region of the viscus itself is known as true visceral pain. It is poorly localized and is dull or heavy. Pain arising in viscera may also be felt in the skin of other somatic tissues, supplied by somatic nerves arising from the same spinal segment. This kind of pain is called referred pain. If the inflammation spreads from a diseased viscus to the parietal peritoneum, it causes local somatic pore in the overlying body wall. Viscera usually have low amount of sensory output, whereas skin is an area of high amount of sensory output. So pain arising from low sensory output area is projected as coming from high sensory output area. Mnemonics: inferior vena cava tributaries I like to repair so fish. Iliac veins. Lumbar veins. Testicular veins. Renal veins. Superrenal veins. Hepatic veins. Branches of abdominal aorta, 3 ventral unpaired visceral, coeliac axis. Superior mesenteric and inferior mesenteric arteries. 4 lateral paired visceral, inferior phrenic. Middle superrenal. Renal. Gonadal arteries. 4 dorsal paired, 4 pairs of lumbar. 3 terminal, 2 common iliac and median sacral. Inferior vena cava is the largest and widest vein. Coeliac plexus is chiefly sympathetic. It also contains fibers of parasympathetic system through vagus nerve. Pelvic splanchnic nerves arise from S2, S3, and S4 segments and supply parasympathetic fibers to the distal parts of digestive tube, urinary bladder, urethra, prostate including the genital organs. Cistern chyli is the largest lymphatic sac.